Hey there, I heard that you might be worried that you have mesothelioma. I'm Jen Finelli, and I am a physician and online medical information educator, and I would like to help you go through some different questions so we can kind of investigate your fears and assuage your doubts a little bit and give you the right information to ask your personal doctor. I'm also going to do a little bit of a physical exam and show you some different images to kind of help you out today. First off, how are you? A little bit anxious? Okay. Well, how long have you been feeling short of breath? Okay. Yeah, so shortness of breath and what we call nonpleuritic chest wall pain are actually the most common presenting signs of something like mesothelioma. Either one of those happens in 60 to 90% of patients. However, those are also really non-specific symptoms that occur in a ton of other diseases. Excuse me and excuse my hair. I'm a very real person, so we're going to talk very real during this whole encounter, okay? Exactly. So other things like being easily fatigued or having sudden and unexplained weight gain are kind of red flag signs. So when you have chest pain, does your chest pain worse when you breathe? No. Okay. All right. That's what we call non-pleuritic. Pleuritic is if as you breathe in and out, you feel pain. Sometimes you can have a chest pain, like a chest wall pain, like after you've had a really bad pneumonia or a really bad cold or flu, where your chest hurts from coughing so much. That's different also. Okay. And then I actually have some information here that I'll be able to show you pictures on my computer as well. Yes, so I am a real physician. I'm talking very quietly because you and I are here in this secret place that we call the internet. And so everything that you and I talk about is secret medical self-care for your information only, not official medical advice, because you and I have not met in the official meat world. However, I really do want this encounter to be relaxing for you while we kind of go through some of your concerns regarding things like mesothelioma, specifically mesothelioma in this case. So what is it? So mesothelioma is not lung cancer. Mesothelioma is cancer in the lining. It's when the mesothelial cells in the lining around your lung start to grow out of control. As you've seen from all the ads, which I'm sure is why you're here, because you're anxious about something ads have shown you, the lining reacts to things like asbestos. However, usually you get the actual mesothelioma about 20 to 40 years after the asbestos exposure. Yeah, and you shouldn't have like small lungs because of it in the past, or things like recurrent pneumonias, other things like that can cause long-term lung damage. Smoking causes long-term lung damage. That's all different. That's kind of a different set. You'll see a different set of biopsy findings. You'll see a different set of imaging findings. So mesothelioma is very specifically cancer in that lining there. Yeah, and so the incidence is increasing. I know, and I know it's stressful. We worry about these things. The incidence is increasing, but that's even though asbestos exposure should be dropping, because sometimes it takes a little while. And I'm actually going to take my coat off to make you a little bit more comfortable so that we can chat a little bit more heart to heart while we go through these different things. So it's also possible to be asymptomatic. Have you had a chest x-ray recently? So if you're having symptoms, that's worth it. It's worth checking in and getting a chest x-ray with your physician if that's something that you can afford and something that you want to go for. So usually the real thing, the first thing that's going to be noted, though you might not even need a x-ray, because in most patients, what we do is on our physical exam, when we find some kind of sign of pleural effusion, and I can show you how that's done. I'll do that on you. So you see how that's done. Exactly. And I have my little computer here to show you pictures in a second. Exactly. So other kinds of things that can cause, shortness of breath and extreme weight gain. I mean, have you been having a lot of weight loss recently? So the weight loss that you would experience due to mesothelioma would be, very sudden in a very short period of time. So if you're trying to lose weight and you lose 10 pounds in a month, that doesn't count. You lost 30 pounds in a month without even trying. Really sudden weight loss. Obviously, usually this is in people who are over 50, where it's like a surprise and sudden and a little bit maybe concerning. Mm-hmm. Absolutely. If you have things like a fever or you have gunk coming up, that's looking more like things like a pulmonary infection. If you have a long time history of smoking and you're having difficulty breathing, it's more like COPD, right? Really, the findings are going to be what we hear on the lung exam. Mm-hmm. Yeah, I can go ahead and do that for you now, and then we can continue our questions afterwards. I'll show you how that's done. I have my doctor bag here. When I graduated from my medical school, I went to medical school in Puerto Rico, which is a United States medical school, because Puerto Rico is part of the United States, so it was within the LCME accredited system, just the same as like in New York or California. When I graduated, the speaker talked about the philosophy of the black bag, where the physician, in the old days, was always at the disposal of the patient and is there to take care of you, and comes with their black bag. You can't fit an MRI machine in the black bag, but you can fit a whole lot of love and compassion. So I got a black bag, and I carry it with me every time I go work somewhere. Sometimes, so I predominantly, my background, I've been trained and I worked for a long time as a military physician. Not a long time, 3 years. I am currently a generalist. I'm working on my fellowship of advanced wilderness medicine, and I was a sexual assault medical forensic examiner for a year. Mm-hmm. That's kind of where my background is, which means as a generalist, I would be the kind of person who sees you, hears the finding, becomes concerned, gets the x-ray, gets the imaging set up, and gets you on your way to an oncologist. So just like your PCM. So the kind of questions that I'm going through with you are the kind of questions you can talk to your PCM about. You can say, hey, I have this history of, asbestos exposure 20 to 40 years ago, and I'm having some difficulty breathing and some chest pain that it's not like crushing. It's not like, it's just like this constant tight chest pain there. It doesn't matter if I breathe in and out. Sometimes it might be sharp, but it's just like this constant chest pain. I'm worried about this exposure. Can you take a listen to my heart and lungs? And so forth. And I'll take a listen to your heart and lungs right now. So when we're listening just to lungs, I'm going to listen 4 spots in the front, and I'm going to listen in the back, okay? So when I listen here, I ask you to take a deep breath in and out, and again over here, and here, and here. Okay, and then here in the back. In the back, we're listening to a big L, so it's like 8 to 12 spaces in the back. The total number of spaces we listen to will be around 16, because 4 in the front, 12 in the back. Let's say 12 to 16 spaces. Deep breath in and out. And again in this spot. And out. And what I'm listening for is I'm trying to hear a fusion, which means I'm listening for weird crackling sounds, like there's a liquid in there, like kind of. It's hard to make the sound exactly. It's like a wet, spitty sound. But it's different than like the snoring of Ronkai, which you sound good, by the way. Ronkai sounds like snoring, like deep inside, and that's more like pneumonia. The crackles sound more like there's a water or liquid in there. Mesothelioma causes a liquid buildup in the lungs, like the vast majority of times. Alright, let me finish listening. Deep and out, and in, and out. And then over here on this side, same thing. Deep So in addition to listening to those crackles, that might be a fusion. I'm trying to see exactly where you can hear them. And then the other thing that I would do is I would ask you to say 99, because I want to hear how is the fluid, if there is something, you can hear what's called bronchophony. Bronchophony is how the sounds are transmitted through your lungs. If there's a sharpness to the sound, if it's very, very sharp and distinct and short, then that means there's like something there. Usually it's airy and like whoa is how it's going to sound. So your 99 is going to sound kind of like whoa, like very like almost far away normally. And something like emphysema, where your lungs are really puffed up, is going to be even more airy and far away. That'll be decreased bronchophony, and increased bronchophony is going to be if I hear it very like, sharp. So I'm going to listen here. Can you say 99? Can you say 99? Alright, again. And again. Yeah, perfect. Okay, the other side. 99. And again. And again. Alright. Then the other sound I'm going to have you make is I'm going to have you go E. If there's a mass or something there, it'll sound like A. Otherwise, it'll sound like E. And fluid can also change the character of the sound in a similar way that a mass can, depending on how thick it is. But usually that would be a mass. All right, go ahead. And again, say E. And again. And again. Okay. Same thing over here. Say E. And again. And again. Okay. The other thing that I do is I'll tap on your back, on your where your ribs are, because I want to hear between the ribs and hear if it sounds full or empty, right? So that is the next thing that I'm going to do. All right. And for this, I have to really be all the way behind you. So excuse me, and I'm going to really get behind you. Kind of. All right. Okay. Same thing over here. I'm going to really get behind you here. And that's, I'm just hitting in between in the spaces. And what I'm trying to hear is, like I said, is there something there instead of a hollowness? Because your lungs are supposed to be hollow. And obviously this takes practice. I mean, so you can learn a lot of information that physicians learn by using resources like Medscape, pubmed.gov, like reliable resources where you can get research and information. The thing that really sets you apart as a physician is your skill interpreting that information, finding new information as it becomes available, and integrating that with the physical exam, like being able to hear and feel little things, and because I think any monkey can kind of interpret certain tests and so forth. It's more putting the whole picture together with the physical exam is, I think, where you really need a physician versus just, this is information I found online. Otherwise, I think that it's good to look for information any source you can, and actually I recommend often for people to get books, because you can learn so much. So, right, like one good book that physicians use that you could use for your own health if you're able to kind of understand the information is this Pocket Primary Care. It's something that we use, right? And it goes, a lot of it to understand it also, it helps you to have the scientific background, but you can always look up words and little by little come to understand that, or ask questions. Always ask questions when you're with your physician. Okay, so another thing that I look for is I actually watch your respiratory rate. I do that while we're getting the vitals. The medic should be doing that while they're listening to your blood pressure, and watch how many times your chest is rising and falling and so forth, without telling you, of course, because when we know we're being watched, we always change our respiratory rate. And then another thing that I always look for, like sitting with you right now talking, I'm looking for, your chest rising and falling. And then if you have a shirt that's a little bit lower like mine, I'm looking to see if your chest is sucking in at all when you're breathing, having any issues like that. If you're not wearing a shirt where I can really see that, then a lot of times what I'll do when I listen to your heart is I'll do just like this, and I'll ask you to go ahead and let me slip this into your shirt, because it's better to hear against your skin anyway, right? And slip it into your shirt, and then while I'm listening there, I'll make sure that there's no retractions or other problems there. You can also, of course, do the exam shirtless as well, which is the best way, but depending on the patient, right? I had a lot of patients with prior sexual assault histories, and I can just make them take their shirt off so I can listen to their heart and lungs in a way that's stressful for them, unnecessarily stressful, when you can get the same information in other clever ways. And in the back, one thing, I don't know if you felt it when I was doing it back there, but right after I tapped, I put my hands like this on your back. Did you feel that? Yeah, when you took a deep breath, what I was watching for is if it expands equally on both sides. So this is the kind of information that we look for. And if in someone who has mesothelioma, you should hear a liquid or a sound, basically on one side. Exactly. And obviously it's a serious thing to talk to your physician about. Let me see what else. While you get comfortable there, kind of get back in your chair and feel all normalized, I'm going to pull something up for you to show you. So, after we find those, so what can I show you? Yeah, let me show you. Basically the next step would be get some imaging. If you hear a little something strange, if you have that history where you had asbestos exposure. Oh, that's a good question. How would you know? So if you had a house that was built before 1960, that's a possibility. It might not have been up to code. People who worked in shipyards. Have you ever worked in a shipyard? Okay. Where else did you work? Oh, and family members exposed to the same thing should also be evaluated. Exactly. Yeah. I like talking to you. You are a very intelligent person to talk to. So, do you get tired really easily? That's another symptom. Okay, but with the chest pain and the difficulty breathing. How about night sweats? Do you sweat a lot at night for no reason? And I don't mean because the temperature is bad or because your wife keeps putting the temperature in weird. I mean, like, do you sweat a lot for no reason? Like, soak the sheets? Okay. I'm just taking note of the things you're saying. Yeah. Usually, yeah, I think you're right. I mean, you're not, yeah, I agree. Mm-hmm. No, I definitely agree with you there. Yes, exactly. No, that's true. Yeah. So what other occupations? Okay, so things like shipbuilding, I think I mentioned, mining in places where you have crocodolite. I can look up the exact word for you. It's a little bit hard for me to say. It's crocodolite is what it is. Things like ceramics, paper milling, or auto parts. Yeah. Do you have family members who work in that? Additionally, railroad repair, or obviously insulation, since that's where asbestos was. There are times when you have environmental exposure to naturally occurring asbestos. It is actually also a natural chemical, not just something made by people. I don't know if you do unusual things like areas where you were the first to farm an area, or urban development of an area. Yeah, no, that's a possibility as well. There's another substance called erionite that's similar to Asbestos, it's been in building and construction in the Cappadocia region of Turkey. Mm-hmm. So those are kind of your exposure things. But I would look at your exposure along with these other symptoms and so forth, and kind of see, put the whole picture together. And that's why it's important to also get the imaging and everything else. Let me show you this picture that I want to show you. I keep looking over at it because it's informative. But basically what we do is to make the diagnosis is we get that information, that history, the questions that you and I just shared about those kind of working exposures. Oh, did I mention paper milling? Did we talk about that? I might not have mentioned that one. Yeah. Absolutely. So, again, the things that, and we'll go over them again because I know it can be difficult to remember. Mining, shipbuilding, cement manufacture that involves asbestos, ceramics, paper milling, auto parts, railroad repair, or insulation are common jobs where you might be exposed to it. It's really not supposed to be in insulation and housing since after the 1960s, but yeah, because of your age and because asbestos will, or asbestosis, sorry, not asbestosis. So asbestosis is a different thing. That's when your body has an inflammatory reaction within the lungs themselves to asbestos. That's a very good question. And it'll actually change the appearance of the lung on x-ray, and that'll be basically a fibrous buildup in your lungs. Mesothelioma is outside the lung in the bag that's holding the lung. These little mesothelial cells, which is the lining cells, grow out of control. Yeah, so that's a different thing. It is related to asbestos exposure, but it's a slightly different monster. Exactly. Yeah. Well, and because it's such an easy, because it's such a horrible diagnosis, and it's so easy to pinpoint it to an exposure, is why you see all of these ads on TV and all these lawyers trying to get you to join them about this, because it's a really easy way for a lawyer to make a quick buck. So that's why you see a lot of scare marketing on TV, because this is where the money is. Somebody who gets mesothelioma, it's really terrible news, because the prognosis is not very good, right? So you hear this bad news, and one of the stages of grief, you're kind of looking for somebody to blame. The lawyer gives you that, because with mesothelioma, it is easy to find who was to blame, compared to some other things. Like there are a lot of cancers where, like the majority of people with lung cancer inside the lung, it has to do with smoking, right? And that's going to be more of a self, looking for somebody to blame. You're not going to sue yourself with the smoking, even though that's obviously kind of a blunt way to put it. It's not. We don't fault or judge people for the terrible diseases that they have, right? It's not like, oh, you deserve lung cancer because of this. That would be truly awful. We help everybody for everything they need. And sometimes because of things that have happened, because of stress, people will smoke, and then they'll have, these things can happen in their lungs. It doesn't mean they're a bad person or anything like that. One of my, big heroes, Sojourner Truth was a big smoker. So people just, these are things people do to themselves. But it's different, because of that, because some things, other diseases will have either a lifestyle related, or complication, right? Not to say that everyone with lung cancer was a smoker, or that you definitely don't deserve, it's not like we don't want bad things to happen to people or judge people. I really hate it when doctors are very judgy. I think that's the worst and isn't therapeutic at all. But so all that aside, right? Mesothelioma is different because things like diabetes, it's like, well, who gave me diabetes? It's very broad and nebulous. It might have been a genetics issue. It might have been genetics plus lifestyle. You might have had some unfortunate pancreatic damage. There's a lot of things that can whereas with mesothelioma, it's like usually fairly easy to pinpoint, and the lawyers will usually help you pinpoint it because they'll dig back into the past. So yeah. So that's why you see these scares and things like that on TV. It's not the most frequent cancer, but you would think that from TV advertisements, right? And obviously it's a very, very serious and significant cancer. So after we do these questions in the physical exam, the next step would be this imaging. So I would like to show you images so you can kind of see what the x-ray looks like and feel comfortable with it. Yeah, I know. That's where I would send you next. That's where I would like to send you. I think I have a beautiful, I should have a good media gallery here. I'm going to use the Medscape media gallery to show you. I really like them. Obviously I have a membership with them as a physician, but you, I think, can get a membership without being a physician too, which is pretty cool. So let me find just the right picture for you here. So a PET scan's not useful to you. You're not going to see a lot of that. So here we go. I think I can show you here. Hold on my laptop. So this is what we call a pleural effusion. This is a 58-year-old male with mesothelioma. And you see how this side is all open? Right? That's how it's supposed to be. And this side, it's like full of liquid all the way. It's supposed to be more open. And you can see this hazing on the side. There's like this, and that's mesothelioma. This actually looks solid. This looks to me like this might be the actual tumor. And then this is the effusion. The effusion is the soft, hazy white part. Sometimes you'll just see effusion around the edges. You don't see that here. But you'll see like blunted edges, and that'll be. But here you have the effusion is all around here. That's the effusion, and then that's most likely the mass there. A portion of this is, your heart sits here as well, but your heart is supposed to be in front of a big open lung like this. It's supposed to be lung and then the mass of your heart over here on this side, but instead it's this, you see that? So that's kind of what we would look for in x-ray. That person has significant shortness of breath. It's challenging for them to breathe. And that's kind of what we would look at next. Afterwards, we'd look at a CT scan. To really diagnose mesothelioma, you would need a chest CT with contrast, right? The contrast is, and so if you're allergic to contrast, you need to let the radiologist and your physician know so they can find another way to image you. But a chest CT with contrast. Oh, what's contrast? Oh, it's like a dye that, you put in your body so that you can highlight these areas. It's like radioactive so that you can see. Yeah, so chest CTs, you don't want to just get a chest CT willy-nilly because it has like 30 times the radiation of an x-ray. And it's that's not good for you to get all the time, right? To get a bunch of radiation. But for, if you meet criteria and it's like, okay, you might have mesothelioma and we need to check, it's worth it to check. It's not gonna be a bad thing. And actually, yeah, it's a risk versus benefit. There is not a lot of, so far, I don't think there's a single study that can really demonstrate somebody got a cancer from x-rays and imaging. We just know all the calculations and all the studies. I spoke with a toxicologist about this that I worked with last year. And all the real studies we have on radiation and radiation poisoning are actually based on like the horrible incidents like Chernobyl, where we were able to watch as the people died what percentage of radiation they had. So that's how we calculate radiation safety. Because we're like, okay, so this percentage, this much radiation over this period of time, these number of rads, right? And that's why we would say, getting too many CT scans, you don't want to get to this level. There's not a lot of evidence that I've not ever seen a paper that anyone's actually gotten to that level. However, people who have constant occupational exposure, like radiology techs who need to be wearing protective garments to protect them, that's a different story. That's where you're getting that constant exposure. Because you don't want to be getting the full radiation of a CT scan every single day. Yeah, exactly. That's a different story. So it's worth it to get you a CT scan after you've had the x-ray to make sure. And in somebody who has the, exposure history, we would get the chest CT scan right away. just to make sure that all is well. And then another thing we would do is thoracentesis, and that's according to the NPM guidelines, which is one of the big mesothelioma associations. A thoracentesis would be next, and that's don't freak out or be squeamish. That's when we take a little needle and we'll put it in between your ribs and basically suck the liquid out. Have I done those? I've worked with pulmonologists who've done them. I've helped pulmonologists do them, and I've been trained on them, but I have not. No, I don't do those. I would have to work with a pulmonologist a little bit longer in order to get skills on that, but there are generalists who know how to do them. If you're very lucky, your generalist might be able to do your thoracentesis. Most of the time, your pulmonologist will do that. So, and then a pleural biopsy also should happen first, although it's better to do it while you're doing the thoracentesis. You could put a thoracoscope in there, then it's less risk of things like, the more you cut someone open, the more risk of infection, stuff like that. And that all helps you to really establish the diagnosis. Unfortunately, it goes really in detail. We can go in more and more detail if you want. There are labs that can be taken. They're very rare and kind of new, but there are blood labs that can be taken as well to check and see the levels of certain, how do I call it? Certain markers, certain biochemical markers. Why do we take out the liquid? Oh, well, partly you take out the liquid in the lung because then it helps you breathe better afterwards. But also we want to analyze the cells and see if what kind of cells there are. Now, different than a lung cancer, the liquid in a thoracentesis for mesothelioma will be more clean. Might not have the same number of bloody cells and everything like that. A cancerous one will usually be very bloody, and there's a lot of things in it that are blood cell components and things like that. Versus a mesothelioma might be a little different, but you can't trust only the cells alone. You actually also have to do a histochemical analysis and send the cells, not just, so what I'm saying is you're not just going to check the cell counts. There's an additional test for that liquid where you'll actually have a pathologist go with his microscope and look at them to see if he sees something wrong, and he'll stain it with different colors to see if he sees basically mesothelioma cells. Yeah, exactly. I wanted to show you, I know I keep looking over here because I have another picture I wanted to show you. I'll show you the CT scan, what a CT scan looks like with a pleural effusion and a mesothelioma. So this is another person who had shortness of breath because of mesothelioma. So a CT scan is different than a X-ray in that we kind of like take slices of you, not real slices, but the imaging is slices of you this way. So this is like if you were to cut someone in half. This is your spine. These are your ribs, right? This is the one lung, which is clean, and this is the other lung, which you can see there's a liquid all through here. There's only a little bit of air, and there's a real thickening in the lining of the lung. And that's really characteristic of mesothelioma. And that's the kind of stuff that they'll look for. So what would they see on biopsy? Okay, so that's a little bit of a tough question, but I'll show you. So everyone in medical school is trained on some pathology where you have to look at different pictures and memorize what's a normal cell, what's not a normal cell. But to be actually a pathologist, most physicians no longer do that. Like most physicians don't look at slides and see that. That's something the pathologist does because that's something they're an expert in. Because to really be good at it, it's something you have to do day in, day out. You have to always be looking at these images and get really, really knowledgeable. And I will show you why. So, this is a picture of a mesothelioma on slides. Again, these are all from the physician section of Medscape that we use when we are basically getting more information for our patients. These are papillary cells on the outside, and then inside it almost becomes like a more spindle morphology, and these are all plaques of mesothelioma. However, this looks very similar to the untrained eye to a lot of other pink mess, right? To a lot of other cells and what they look like. Here, I can show you a different one. Here is, so here you have some papillary formations, and then you also have kind of a more spindle cell formation here on this side, right? And so the pathologist would look at this and do some staining on the cells. Mesothelioma is actually a little bit special, so that pathologists will actually even have to do some extra things on it besides just looking. They'll have to do different staining, just because it is a very specialized diagnosis. You have to have specialized education in it, even above and beyond what a so, right, I'm a generalist. The oncologist has some additional training, and that's after, right, I have 10 years of school behind me. I did 8 years of just school, and then an additional year, basically 2 years of like kind of internship and part of a residency training, like where you're practicing medicine, basically. And then after that, I went into practice with the military. And even that's not enough. Like 10 years of schooling and training is not enough. That is a third of my life, and that's not enough. The oncologist will then do 4 or 5 years after that, because they have to do 3 or 4 years of internal medicine and another 4 years. And the pathologist will do 3 or 4 years after medical school, and then they will sometimes to get additional oncological training as well, depending. Your pathologist is very specialized in looking at pictures. So I don't know if you can really tell the difference between these different sides. These being more papillary cells within the chunk of mesothelioma, and these are more spindly cells. But to really make that diagnosis, obviously, you have to be a well-trained pathologist. And some people right out of medical school are still really good at pictures. The pictures that I'm good at tend to be more women's health pictures. Like, I can recognize a clue cell, I can recognize, yeast, I can recognize yucky things that come out of the lady parts, right? That's the kind of pictures that I still have, skill looking at. But unless you're, looking at these kind of pictures day in, day out, it really just looks like pink goo. So I would very much trust your pathologist. Yeah. I know everyone who comes to me is somebody who's really intelligent like you and really wants to learn and get a lot of information. And so I always try to give you as much information as possible. There is some level of trust, though, that you have to establish with your provider. And if you don't have trust with that provider, you can always seek a second opinion. Yeah. It can be very stressful to worry about this. And I know sometimes people will feel blown off by their physician. Yeah, they'll feel like, I'm sure I have this disease and my physician is saying I don't, and, they're blowing me off. A lot of times they're not trying to blow you off. They just might not have very good communication skills to explain to you why you don't have this or that thing. Yeah, I'm glad. I hope that some of this information is helpful to you. Absolutely. Yeah. So we'll do a follow-up. Take these questions home and think about these things. And I would recommend you going back to your PCM if you have questions or concerns. Yeah, and then you can always come back to me. I'll do we can have another chat about your mesothelioma concerns at another time. Yeah, and you can get more information. Yeah. I think that knowledge is power, so I really wanted to talk to you about this today because I wanted you to be able to have the information and know, like, oh, this is what it's like. This is the information that I need to be looking for, so you can feel kind of reassured. Like, if you have none of that, and you don't have that history of exposure, it's not something that you really need to worry about. If you have that history of exposure and no symptoms, just check yourself for symptoms, and when necessary, go to the doctor to ask for an x-ray. Yeah. It's one of those things that it's not that hard to find and hunt down. It's just that establishing the diagnosis is a little bit of extra work for your oncologist. Like, you really gotta, at what point would you go to the oncologist? Well, I would go to my generalist first for my physical exam and my x-rays. And then if there was something unusual about that, and actually, yeah, even, yeah, exactly. Yeah, I interrupt myself too. So that's what I would do first. And then the next thing is it would depend on the skill level and access level of the generalist. So then I would order the CT scan. That's what I would do. I'm very comfortable just ordering the CT scan, and I would get somebody to do the thoracocentesis. Maybe I would even, depending on, again, your generalist level of training, some internal medicine generalists know how to do thoracocentesis as well. Internal medicine isn't really a generalist anymore. They have 4 additional years of training also. It's just a different kind of specialization. They're specialized in what's inside an adult. That's why they're internal medicine. Versus family practice, specializes in what's going on and how health interacts throughout a family and throughout your life from the time you're little to the time you die. Yeah. And then a generalist like me kind of gets to pick and choose what I learn. Like I said, I'm mostly doing women's health, and wilderness medicine has been kind of my shtick. Because, I did operational medicine as a soldier on my deployment. Yeah, no, it's nothing fancy like that. That's why it's good to have a doctor who knows their limits too, because they got to know when it's time to send you on. For me, the thoracocentesis, if I saw anything unusual in the x-ray, I would order the CT scan and the thoracocentesis at the same time. I would refer you to the oncologist or another internal medicine specialist for thoracocentesis, and then I would order the CT scan, and then I would ask the pulmonologist or a oncologist to do the biopsy. Really, probably a pulmonologist would be the first place that I would send you. And then, depending on those results, I, as your PCM, would coordinate with your, and make sure to have phone calls and communication appropriately with your pulmonologist and your oncologist, as we figured out what was going on. That's really, your generalist is supposed to be kind of the person who solves as many problems as they can and knows how to get you the resources to solve the problems that they themselves can't fix hands-on. Like, they will still fix your problem, but they'll use a different person, a specialist, as a tool. I really do see specialists as like the toolbox in your bag that you get and call. I think a phone or the ability to write a referral is one of the biggest, superpowers that, yeah, exactly. So, yeah, I hope that, do you have any more questions? Okay. I really want you to be able to take a deep breath and feel like, okay, no matter what happens, I have information. I know where to find information. I know what to do. I feel like knowledge is power against anxiety and concern. That's the difference between me and the lawyers. No, and as much as I joke about lawyers, don't hesitate to contact one if you need to. Yeah. I mean, if you know that you were working in a shipyard and your employer didn't appropriately, keep within OSHA regulations and exposed you to dangers they shouldn't have exposed you to, by all means, sue that bastard. Yeah, because it's not just about you anymore. I mean, at that point, you need to protect other people from being abused. Yeah. I make jokes about lawyers because I am very much against frivolous lawsuits where it's like they're just trying to get everyone they can to join up. Because, like I said, there's big money in mesothelioma. But, they serve a purpose. So despite my joking, don't let my information stop you from going to talk to your doctor, and don't let my joking stop you from getting a lawyer if you need to, right? Because you might need to. And by all means, if you have these kind of red flag signs I'm talking about, again, especially if you're having difficulty breathing, you're having a chest pain that you can't really explain, you're having, fatigue for no reason that you didn't have that's progressed rapidly over a couple months, you're having, serious night sweats where you're soaking through the sheets, the unexplained weight loss, please go talk to your physician. The unexplained weight loss is a big one that a lot of times people don't mention to their physician because they think all weight loss is good. But, talk to your provider. Yeah. My hope is that talking to me will help you catch it if you have it, so that I can be the first, your first point to go catch it. And secondly, that if you don't have it, this is kind of a relaxing video to give you the information that you need to protect yourself against anxiety. Yeah. All right. Well, I hope that you have a good night. It's late out there already, so I gotta close up shop. All right. Thank you for coming in.